I think that the media and the recent explosion of information regarding sleep-disordered breathing has led a lot of people to direct a lot of questions towards me and our treatment of sleep-disordered breathing. The sleep science, the study of sleep, the knowledge of sleep, the understanding from a medical standpoint of what goes on during sleep is still somewhat of a relatively new frontier, and we're learning all the time all the ramifications, the health ramifications of what happens with a disturbed sleep cycle or a disturbed night's rest. The research in the literature has shown that this is a health issue that has huge ramifications. Upwards of 24% of middle-aged men, 9% of middle-aged women are going to be affected by sleep-disordered breathing. Studies have shown that 4% of men and 2% of women suffer from daytime sleepiness. These are a lot of people out there, and one of the major risk factors with sleep-disordered breathing that we know of is an increase in BMI or an increase in one's weight. We are a society that is gaining weight. The statistics show that, so we are seeing a rise in this. It's a health issue that needs to be addressed. About 25% or 1 out of 4 Americans are at risk to sleep-disordered breathing. The health ramifications of sleep-disordered breathing with other facets of one's health are well documented. 75% of obstructive sleep apnea patients have a higher incidence of hypertension. People, especially men with obstructive sleep apnea, have an increased risk of stroke, and as much as 11% of postmenopausal women suffer from sleep-disordered breathing. So these, if you look at the numbers of people in our society, these are big numbers. This is a large health issue and one that deserves the appropriate attention that it gets. It doesn't only affect adults. We know that 25% of the kids with ADHD or attention deficits, some of these kids are suffering literally from just a sleep issue. That proper treatment with tonsillectomy and adenoid removal, upwards of 25% of the kids that are currently medicated for some of these attention deficit disorders actually don't need it. So the spectrum really is community-wide, all the way from children all the way up to our mature adults. All need to be evaluated, or we need to have a working understanding of their sleep and how it affects their health overall.